Hi everybody, so I'm starting a series of videos today on sciatica. Sciatica, we treat lots of patients in our office who have sciatica, and that's basically a condition where you start to get pain, maybe in the lower back, but it starts to radiate into the butt, into the hip, and then potentially down into the leg or even into the groin. And many of my patients come in and they're not really sure if it's like a pulled hamstring or if they actually have an issue. More times than not, the way that we can determine this is by taking x-rays. So when we take an x-ray of a spine, I can see clearly where the spine might be out of alignment, or what we call subluxated, meaning vertebrae shifted or bones, pelvic bones shifted that are compressing the nerves. The nerves that come from this lower part of the lower back make up these big nerves that go down the back of each leg, called your sciatic nerve. So this is my patient. He came in with sciatica. One of the things that we measure is the pelvis, to see if the pelvis is level. In this case, that's the top of his right pelvis. And if we extrapolate that line across and then put it where the top of his left pelvis is, you can see how out of alignment his pelvis actually is, and his whole spine in general. The dots is actually where his spine is. If we were to put a plumb line down, you would see pretty clearly that his spine is pretty crooked. In this case, his pelvis is off by 20 millimeters, which is a big shift in his pelvis. The nerves that come from this area go into the hip and all the way down into the leg, and he has sciatica down his left leg. So this is a pretty clear-cut case, and I can see very clearly, and so could my patient, where his problems were, because his pelvis is so shifted out of alignment. So if you're struggling with sciatic pain into your hips or down into your leg, maybe even in your groin or in the front of your legs, more than likely it's sciatica, and it's coming from your lower back and can absolutely be helped in our offices. But of course, we would want to take some pictures to confirm, and on certain pictures, it's very clear where the problems are. So don't suffer, don't wait, come into our offices, get it checked out so that you don't have to live in pain shooting into your legs, or it's awful pain. So make sure you get it checked out and we get it corrected the right way, without drugs, without surgery, with chiropractic care. All right, Dr. Jody signing off.